CNA Practice Test 2026 Certified Nursing Assistant Full Course Terminal Illness End of Life Care. Question 1. What is the CNA's role in the care plan? Write the care plan. Report observations to the nurse. Prescribe medications. Change the care plan. CNAs provide valuable observations that inform the plan of action. Question 2. What is subjective data? A fever of 101F. A resident saying my head hurts. A red rash. A heart rate of 80. Subjective data is what the resident reports. Question 3. What should you do if a resident is unconscious during oral care? Don't do oral care. Turn them on their side to prevent aspiration. Give them a glass of water. Brush their teeth while they are on their back. Lateral positioning protects the airway of an unconscious patient. Question 4. What is the first sign of a pressure ulcer? A deep hole, bleeding, discoloration or redness that doesn't go away, a scab. Stage 1 pressure injuries appear as non-blanchable redness. Question 5. How can a CNA help prevent pressure ulcers? Massage bony prominences. Keep skin clean and dry. Leave the resident in one position. Use plastic sheets. Moisture and pressure are the leading causes of skin breakdown. Question 6. What is empathy? Feeling sorry for someone. Understanding and sharing the feelings of another. Ignoring someone. Being mean. Empathy allows the CNA to provide person-centered care. Question 7. What does PASS stand for in fire safety? Pull, aim, squeeze, sweep, pass, act, stay, stop, push, aim, shake, slide, pull, arm, stop, secure. PASS is the acronym for using a fire extinguisher. Question 8. What does RACE stand for? Run, act, call, exit, rescue, alarm, confine, extinguish, remove, ask, circle, end, rescue, always, calm, everyone. RACE is the priority sequence during a fire. Question 9. A resident is choking and cannot speak. What should you do? Give them water. Perform abdominal thrusts, Heimlich. Leave them and find a nurse. Pat them on the back. Abdominal thrusts are the intervention for a complete airway obstruction. Question 10. What is dementia? A normal part of aging. A loss of mental functions like memory and reasoning. A temporary state of confusion. A physical disability. Dementia is a progressive decline in cognitive function. Question 11. Which of the following is an example of an ADL? Driving a car, eating, managing finances, doing laundry. Activities of daily living include bathing, dressing, and eating. Question 12. What is the purpose of post-mortem care? To bring the person back to life. To prepare the body for viewing and transport. To perform an autopsy. To clean the room. Post-mortem care shows respect for the deceased and prepares them for the family. Question 13. What is hospice? Care for newborns. Care for people with less than 6 months to live. A type of surgery. A gym. Hospice focuses on comfort and quality of life at the end of life. Question 14. When should a CNA use a sharps container? For dirty linens. For used needles and razors. For food waste. For old papers. Sharps containers prevent accidental needle sticks. Question 15. What is aphasia? Inability to walk. Inability to speak or understand speech. Inability to see. Inability to hear. Aphasia often occurs after a stroke. Question 16. What is the proper way to dress a resident with a weak side? Dress the strong side first. Dress the weak side first. It doesn't matter. Don't dress them. Dress the weak side first, dress affected weak. Question 17. What is sundowning? Worsening of confusion in the evening. Feeling better in the morning. A type of skin tan. Sleeping all day. Sundowning is common in residents with Alzheimer's. Question 18. Which of the following is a symptom of hypoglycemia, low blood sugar? Extreme thirst, shakiness and sweating, dry skin, sweet-smelling breath. Low blood sugar causes rapid onset symptoms like tremors and diaphoresis. Question 19. What is a CVA? A heart attack, a stroke, a broken bone, a lung infection. Cerebrovascular accident is the medical term for a stroke. Question 20. The scope of practice for a CNA is determined by the resident, the State Nurse Practice Act, the CNA's friends, the doctor. Regulations vary by state but define what a CNA is legally allowed to do.